Hello, I'm Dr. Shweta Bansal. I'm a pediatric hemato-oncologist and bone marrow transplant physician. Today, we are going to talk about the sickle cell disease because it's 19th June, which is celebrated as Sickle Cell Day, and we are going to increase the awareness about the sickle cell disease today. So, sickle cell disease, we all know, is a common, most common inherited hemoglobinopathy, and it leads to lot of decrease in the quality of the life and leads to morbidity and mortality. So today we are going to discuss about the sickle cell disease and what are the new drugs which can help us in decreasing the sickness in the sickle cell disease. So my topic for today is the new armamentarium for newer drugs to gene therapy, removing the sickness from sickle cell disease. So we are going to talk about not only the drugs which can help us in decreasing the sickle cell disease, but also about the various newer therapies like gene therapy and stem cell transplant, which can help us in decreasing the sickness in the sickle cell disease and also help us in the cure of the disease. So first of all, what is sickle cell disease? We all know that in our body there is a hemoglobin which is carried by the red blood cell. These red blood cells are in the shape of coin. So when they are in coin shape, they are like circular in nature, and when they pass through our blood vessels, they are able to pass very normally in a very normal fashion, and they are able to change their shape also. But when the sickle cell happens, when the sickling in the cells happen, they change their the shape from the normal circular shape to the boat shaped cells. So these are known as sickle cells because they are sickle in shape. You can see in this picture there is a sickle shaped cells. These are the abnormal cells. The problem with these cells is that they are very rigid in nature. They cannot change their shape, and when they pass through the microcirculation through the small vessels, they actually cause the occlusion of the vessels. You can imagine like a certain car in which the tires have got flattened, the car structure has got deformed, and when that car is passing through the narrow passage, it is not able to pass through that passage and it starts blocking that passage. So other cars which are coming towards that side also starts getting crashed and leads to the obstruction of the pathway and also damages the surrounding walls. The similar thing actually happens in the sickle cell. Once the vessels gets occluded, it starts damaging the vessel, that is endothelium of the vessel, and it also starts the blocking of the pathway. And this leads to problems which actually happens in the sickle cell disease. So what causes sickle cell disease? Actually, sickle cell happens because of the substitution of the single amino acid. What is that? Means that if like we are doing some writing and we do the misspelling of certain words, then the whole word, um, like there is a rate or there is some other word is there, then the whole word meaning changes. Because of that, this is the substitution of the amino acid which happens in the sickle cell also. And because of that, the new protein is formed from glutamine to valine and leads to the destabilization of the hemoglobin. And because of that, the sickling in the blood vessels, sickling of the RBCs happens. Now, what happens, as we have understood, once the sickling happens, it starts obstructing the vessels. Now, because of this vessel, the car starting getting crashed. It means they are getting destroyed. The same thing happens with the RBCs also. So this is known as hemolysis. It means that the RBCs are getting obstructed and leading to hemolysis. So there is a decrease in the hemoglobin. It is leading to anemia. It is leading to jaundice. It also leads to the other problems like stroke, pulmonary hypertension, and ulcers. Now, when the vessels gets occluded, what is the function of these vessels? They supply oxygen to various parts of the body. When oxygen is not reaching to the various parts of the body, they started having hypoxia, and hypoxia leads to the pain. And similarly, other problems happen in which there could be an end organ damage leading to kidney damage. Then the spleen gets damaged, which known as asplenia can happen in the sickle cell patients. And then vasculopathy, that is abnormal vessel inflammation happens leading to hypercoagulopathy. So this is the problem which actually happens in sickle cell disease. Now we know there is a sickle cell disease. There are problems with the sickle cell disease, but from where this sickle cell disease is coming? So it is very important to understand that this is an inherited disease. It means that either mother or father is affected, or both mother or father is affected. If only one of the parent is affected, then there is a chance that the children will have only trait, that is they will not have the disease, and some other children will be completely normal. If both parents are completely affected, they are having a sickle cell disease, then all the other children, all the siblings and children will be having a sickle cell disease. And if mother and father both are having a trait, that is their only single gene. In our bodies, two genes are there. One gene in a child comes from the mother, and one gene comes from the father. And if both the genes are affected, if one of the gene is affected, that is trait, then there is a chance that the 25% of the chance, that is out of 4 children, one child can have a sickle cell disease. And similarly, the other inheritance patterns we see in this sickle cell disease. Now, how to diagnose the sickle cell? Most importantly, it is happens in particular regions and particular areas. So any child or any patient who's coming from that area exhibiting the symptoms of anemia, chest pain, stroke, ulcer, pulmonary hypertension, all these kind of symptoms, then we do the examination of the blood. The testing for sickle cell is very, very simple and very, very economical. We don't need very elaborate test to diagnose sickle cell. We can just diagnose sickle cell on the basis of simple CBC and peripheral smear examination. Then other test we can do is HPLC, in which we see if there is an abnormal protein is present in the body. And then we do a sickling test, in which we mix the blood with certain chemicals and see if the sickling happens or not. So this is a sickling disease diagnosis happens with this. Now, coming to the treatment. So far we have understood what is sickle cell disease, how it happens, how it is inherited, and what it causes. So we know that sickle cell causes hemolysis, it causes inflammation, it causes vasoocclusion, and because of that, anemia and vasoocclusive crisis and stroke, all these problems happen. Now, how to take control of these problems? So we have certain drugs with us which can help us in controlling the symptoms and decreasing the problems which are associated with sickle cell disease, and finally helping in improving the quality of life. See, cure of sickle cell disease happens only by bone marrow transplant and by gene therapy. Other treatment can only help in decreasing the symptoms and alleviating the symptoms. So for decreasing the hemolysis, that is breaking of the RBCs, once they start getting stacked on each other, then there is a breakage of the RBCs. We have to decrease that. How we can decrease it? By decreasing the deformation of the RBCs. How we can decrease the deformation of the RBCs? By increasing the other types of hemoglobin in the RBCs. And this can be done by using drugs like hydroxyurea. Hydroxyurea helps in increasing the fetal hemoglobin, which in turn helps in decreasing the deformation of the RBCs. It also helps in decreasing the inflammation by decreasing the neutrophils, WBC counts in the body. Another drug which we have is voxelotor. Voxelotor actually helps in decreasing the inflammation and helps in decreasing the RBC addition by decreasing the sickle cell polymerization. And because of that, again, the RBCs do not change their shape. They remain in the round shape. And it has been seen that voxelotor also helps in increasing the hemoglobin of the patients. So those patients who are having anemia secondary to sickle cell, and those who are having problems because of the chronic anemia and sickle cell disease, they can be given this voxelotor drug. But however, it does not help in decreasing the pain crisis. Pain crisis is very, very important chronic symptom which we see in sickle cell disease, and it is very important to decrease it. Because of this, the patients get admitted and they can have hypoxia of their end organs also, leading to their damage. So what are the drugs which we can use? One is L-glutamine. It is nothing but an amino acid which helps in decreasing the reductive oxidative stress of the RBCs. So we can use L-glutamine. Then we have crenaluzumab. This crenaluzumab can be used, it is a P-selectin inhibitor. So what is P-selectin inhibitor? It is nothing but it is an it is a agent which helps in the clumping of the platelets and also of the neutrophils with the endothelium, and also this causes the increase in the vasoocclusion, leading to more vasoocclusion crisis. So when we inhibit the P-selectin, there will be less vasoocclusion and there will be more normal flow, and hence the less pain symptoms would be there. So crenaluzumab can be used in the patients who are having a frequent vasoocclusion crisis. Then the last is the vasculopathy. Vasculopathy, there are certain drugs in trial, but they are still in trials and not have been FDA approved. So we can understand that there are only few drugs which can help us in decreasing the signs and symptoms of the sickle cell disease. Now, we are looking for the curative therapy also. Why to live with a disease which is causing so much problem in a person? So what are the things which can help us in cure of this disease? One is the bone marrow transplant, and second is the gene therapy. So bone marrow transplant, what we do in bone marrow transplant, we take the blood from the normal siblings or from the parents and infuse into the patient after giving certain conditioning regimen, which is a chemotherapy which helps in killing the abnormal cells of the patient, and then we give the normal cells of the sibling or the parents or any related person to the after doing the HLA matching to the patient or the child. Now, this will help us in having a normal RBCs after certain time once the engraftment has happened, and then the normal hemoglobin starts coming into the body and the patient is free of the various complications which are caused by the sickle cell disease. The last, so sickle, so in this chart you can see if we take blood stem cells from the sibling, there are multiple symptoms which can help us in deciding whether we can go for the we can go for the match sibling, whether we can go for the match unrelated or haploidentical transplants. As you can see, the indication for the match unrelated and haploidentical donors are less, and there is a strict criteria for the patients to be taken for these transplants because these are associated with certain complications also. But however, if we are doing a match sibling donor, any patient with the chronic symptoms can be taken for this transplant if the match sibling is present. Now, coming to the gene therapy, we have seen gene therapy in sickle cell disease in Western world. In many of these patients, it has been used and it has shown good promising results. And we hope that soon it will be coming to other countries also, and like India. So in gene therapy, what happens? We can do it by two techniques. One is that transduction method, and second is by the gene editing method. In transduction method, what we do is we take a lentivirus and we put a normal gene in that lentivirus, which works as an envelope or as a transmitter, and we inject those cells into the patient's body, and they go into the bone marrow, and then that gene is delivered and it gets incorporated into the normal stem cells, and from there they start producing the normal proteins, leading to a normal RBCs formation. So this is a gene therapy through transduction method. And then we have a gene editing. Gene editing is a little more advanced method. It is like a very precise method in which we cut the abnormal gene, replace it with the cut the abnormal gene and replace it with the normal gene, and those cells with the normal gene are infused into the patient's cells body, and then they start producing the normal RBCs from there, and this is how we are able to have normal RBCs in our body. So this diagram actually shows us the various treatments at various phases. So we have certain drugs which are now becoming the standard of care, which includes hydroxyurea, which includes crenalizumab, voxelotor, and L-glutamine, and then stem cell transplant. Gene therapy is still in the trial phase. Now it is in phase 1, phase 2 trial phase, and other drugs are also in certain phase trials, still not FDA approved, but we are watching it very closely, and we are trying to find whatever the drug is available which can help us in decreasing the symptoms of these patients. So with this, I would say that sickle cell disease is an inherited blood condition, which is the most common among people of Africa, Arabian, and as well as Indian origin. We understand that sickle cell is mostly seen in African origin, but it is not so. We have many tribal areas where sickle cell disease is highly prevalent, and standard of care is required for those patients. The symptoms are pain episodes, swelling of fingers, anemia, frequent infections, stroke, and organ damage. Supportive care and disease modifying drugs can help, and gene therapy and stem cell can be a curative therapy for these patients. So definitely by increasing the awareness about sickle cell disease, we can help these patients to get proper treatment so that the morbidity and mortality can be decreased in these patients. And especially those patients who are eligible for the transplant, we can help and do the transplant of these patients so that they can be relieved from these symptoms for their life. With this, I would thank you for your kind attention. Thank you very much.